I have a chronic disease. 今回は病気について話していきたいと思います。うちの英会話スクールの生徒さんたちの平均年齢がですね、意外と高くて、病気の話がよく出るんですよ。このスクールは2001年にビジネスパートナーと一緒に立ち上げました。オープン当初からずっと通ってくれてる生徒さんがいます。もう24年とかになりますよね。すごいですね。当然、年齢を重ねるにつれて、病気の話が増えますよね。それは当然ですよね。もちろん若い方もたくさんいますよ。でも昔から通ってる生徒さんたちが、ご年配方が多いですね。そういう生徒さんは自分の病気やご両親の病気、それから友達の健康状態についていろんな話をしてくれます。でもこういう健康の話とか病気の話をするのがなかなか難しいんですよね。基本的な病気名なんかはすぐ辞書で調べられますよね。でもね、ニュアンス的な部分までは辞書は教えてくれないからね。なかなか伝わらないことがよくあります。病気の話。持病なんてまさにその一つです。健康というトピックはちょっと広すぎるので、今回は Chronic Disease 慢性的な病気、というトピックに絞ってお話ししますね。So, there should be plenty to talk about in this one. We'll talk about the problem, the reason, the solution, and of course, some example sentences. So, without further ado, let's get things underway. First, let's look at the problem. I have a chronic disease. I have a chronic disease. Just the other week, I heard this one from one of my students, but unfortunately, and perhaps rather disappointingly for me in many respects, I didn't really understand what it meant. I've come up against this situation countless times when talking about health, and what seems like a fairly straightforward expression in Japanese, well, is sometimes really difficult to express in English just by using the words shown in the dictionary. Of course, there are some cultural differences in the way we talk and think about health, but at the end of the day, it all comes down to the way you say it. I'm not feeling so good. What's the matter? Did you catch that bug that's going around? No, it's nothing like that. Nothing serious, I hope. It's just something I have to deal with. What do you mean? I mean, if you're comfortable talking about it, it's just that I have a chronic disease. A chronic disease? What's that? Sounds very technical. I've been living with a chronic disease for years. It makes me tired and out of breath. Chronic? What does chronic mean? Chronic? Haven't you ever heard of a chronic disease? Well, to be honest, I'm not sure what it means. It's a disease that I've had for a really long time. It never goes away. Oh, so that's what it means. Well, you live and learn. So that was an example of one of the many conversations I've had talking about health conditions. In the next section, I'm going to look more closely at the reasons why these kinds of miscommunications can occur, especially between Japanese and English speakers. First and foremost, the thing that I'd like to get out in the open is this. When Japanese people talk about health and getting sick, they often use medical terms just like a doctor would use. Now, you may disagree with me on this one, but it's just how I feel. In English, however, it's almost like we have two languages when it comes to health. The one that doctors use and the one that normal people use to talk about health. Don't get me wrong, there are some people who know the technical terms, but there's usually a reason for them knowing either they got sick themselves or one of their loved ones came down with a particular disease, illness, or a condition. So they learned about it by studying or talking to the doctors. They had to know. Now, you may be thinking, English speakers are lacking in fundamental education. Well, that may be the case for some people. It's very possible. But in most cases, I think it's just the way English speakers talk to each other. It's the way they communicate. Let's take the example, cerebral infarction, 脳梗塞. I hear this a lot in my classes, a hell of a lot, but I had never heard this word before I came to Japan. We just use the very general term, a stroke. Of course, there are various types of strokes, but it's a very good example of formal medical language versus conversational language. 彼は脳梗塞で倒れました. In formal English, we would say, he collapsed due to a cerebral infarction. In everyday English, we would just say, he had a stroke. Now, even although I've explained this countless times in my lessons, a few weeks later, they come back with another medical story and use the same technical jargon or the technical expression which they've taken straight from the dictionary, and again, I don't understand it. I know it's not their fault, but people don't seem to realize the difference between technical medical expressions and like the other language, these everyday expressions which people use more frequently, non-doctor types like me. It's a tricky area, but if you want to sound more natural in English, my personal opinion, for what it's worth, is it's best to use the conversational version. It's the dumbed down version and possibly sounds uneducated, but that's just the way it is. When talking about medical issues, at the end of the day, it's best just to go with the simple version. You can communicate better and more smoothly. Going back to the original sentence, which was difficult to understand and, dare I say, overly technical, I have a chronic disease. Now, how would we say this kind of thing in everyday English? Let's take the example of asthma or zensoku in Japanese. But actually, come to think of it, asthma is pretty well known in English, so it's probably not the best example, but anyway, here goes. I've had asthma for years. I have a condition called asthma. It's not serious, but it's long-term. It's a recurring issue I've been dealing with since childhood. So when we're talking about jibyo, we usually use terms like a condition, a health issue, a problem with my health. We use these expressions for things that you've had for a long time. Some of the more common ones are diabetes, high blood pressure, back pain, and high cholesterol. So they are often something manageable but persistent. Of course, I guess some Japanese speakers would prefer to use the more formal mansei shikkan or mansei no byoki, which they would translate as being a chronic illness or disease. But as I've been saying all along, sometimes it's better to simplify it by using a condition, a health issue, a little problem with my health. Let me talk about two other common health problems that often come up in my classes and how to say them naturally. Gikkurigoshi. Interestingly, this one is similar to English in that most people use the casual version, gikkurigoshi. But there is a technical one called kyusei yotsu sho. Kyusei yotsu sho. Oh, that's technical. Now, if you check the English-Japanese dictionary, it'll probably say a slipped disc, which is good, but in everyday conversation, most people would probably say these. I put my back out, or I strained my back, or even I hurt my back. 心筋梗塞. If you check in the dictionary, the doctor's way of saying it is myocardial infarction. Oh, 心筋タイム. Again, before I came to Japan, I had never heard that one before. In daily English, we would just say a heart attack. He died from a massive heart attack. Smokers are more at risk of heart attacks. Oh, I think I'm having a heart attack. I've got a funny feeling that you might feel the word heart seems kind of cute for such a serious situation, but that's just the way people normally say it. A heart attack. I got a couple of wisdom teeth taken out last year, and the pain was excruciating. Wisdom teeth are the ones that come in last, and we often get them removed as adults. And if the pain was excruciating, it was unbearable, incredible pain. Excruciating. How's your dad getting on? He's made a full recovery. It was a bit touch and go after the cardiac arrest, but he's fine now. So the expression, a bit touch and go, if something was touch and go, it means it was a very dangerous situation. We didn't know whether he was going to survive or not. It's used a lot when talking about health problems, but it's also used when you're talking about sport. If the game or the result was touch and go, we don't know whether we won the game or lost the game. It was like a really close one. So we can use touch and go for health and also sport and other cases as well. The other expression there was to have a cardiac arrest. So this means when your heart actually stops beating and you have to start it again by using some kind of heart massage with CPR or by using a defibrillator, which is also referred to as an AED, which stands for an automated external defibrillator. I had to check that one because I didn't know that. There you go. He was rushed to the hospital with acute abdominal pain. If something is acute, then it is very sudden and usually for a short period of time. This is the opposite of chronic, which is long-term. Now, I must be very honest in saying that I had to study about these words in making this video, and I learned so much about my own language, English. Acute and chronic. Wow. I went jogging for the first time in years last night, and I pulled a muscle almost right away. This is the everyday expression for talking about pulling a muscle. So when I hear the Japanese version of Nikubanare, it always sounds so much more serious and, well, how should I say, meaty. Wow. I much prefer the English version of pulling a muscle. And if it's in an extreme case, you would say tear a muscle, which means like ripping or tearing something. But a regular case is pull a muscle. Have you ever broken any bones? I've been lucky to get through my life without breaking any. Now, if you have, please let me know down in the comments. It would be really interesting to hear. But remember, when you're talking about this kind of thing, I have a little piece of advice for you. So I hear a lot of people saying, I broke my bone. That just sounds funny. So in this case, you would say, I broke a bone. Or if you want to get actually into the details, you can say, I broke my arm, or I broke my finger, that kind of thing. So don't say, I broke my bone, say the other ones. It sounds, I don't know, much more smoother and more normal. Okay, so I'm looking forward to your comments.